Hi everyone, I'm Dr. Nguyen, and today I'm excited to share with you a new device that we just acquired here at Laser Skin Care Center. The device is called Sofwave, and it is basically the newest technology for skin tightening. It is FDA approved for the treatment of skin laxity in the jowl area and the neck. It is also FDA approved for lifting the eyebrows. It is a technology that uses ultrasound in order to heat the skin. So Robin, if you don't mind coming a little closer here so that we can kind of zoom in on this picture. So some of you may be aware that we have Ultherapy, which is a great device for skin tightening, also using ultrasound technology to heat up the skin. This version is a little updated in the sense that it now has 7 columns of heating all at once. So you are able to treat a larger area with every pulse, leading to the need for fewer pulses and a shorter treatment. That translates to more comfort. And the same idea is to heat up the skin in order to cause collagen remodeling and tightening the skin. So as you can see here, with every one of those columns, it gets down to about 1.5 millimeter. This is your skin. The epidermis is up top. This meaty part is the dermis, and that's where most of our collagen lives. So this device kind of heats up between the 0.5 to 2, but mostly at 1.5 millimeter, right at the mid-dermis. And it gets it pretty hot, up to almost actually 60 to 80 degrees Celsius. And at that temperature, you're able to denature the collagen and causes it to remodel. It does so in a fractionated manner, so meaning there are normal skin in between. This promotes quicker wound healing. It also has a cooling tip so that it doesn't hit the top part of your skin where the melanin or the pigment of your skin lives. And by doing so, it makes it safer for darker skin individuals. Sometimes if you heat the skin and you kind of affect the epidermis, you can lead to hyperpigmentation. So this device is safe for all skin types, and it can be used on the face, on the forehead for the eyebrow lift, and on the neck for skin tightening. So here are some clinical results from the clinical trial, and this is post one treatment at 3 months. So here's this gal with kind of like the skin laxity right underneath the chin area and on the neck. And this is the result that she was able to achieve after 1 session at the 3-month follow-up. Here's another one for that jowl and neck area. And because it's also FDA approved to lift up the brow, you can see here that on the post photo, you're able to see her eyelid better because it has lifted up the brow and brought up that droopy eyelid. So today, we're gonna show you how we apply this device. My model here is Lorraine. So we're going to be treating her for the whole facial area. This is a slow device, so it's not super exciting, but I just want to show you how the pulses and the prep goes so that you have an idea of what to expect when you come in for treatment. I personally went through this last Friday myself during the demo, and I would say it's not a walk in the park. I'll be honest, it's a little uncomfortable, but I always tell patients no pain, no gain, so it's probably worth it, the pain that you experience, because we are heating the skin to that 60 to 80 degrees Celsius. It's gonna feel hot and a little bit sharp. And the pulses last about 5 seconds in total, so you kind of feel like a heat that's ramping up right around the 3-second mark, and it lasts about 2 seconds, and it kind of cools down again. So on here, we can adjust, the pulse duration is about 5 seconds. I can adjust the cooling to kind of help with the comfort. We can adjust the energy level, and depending on the skin type, the need for more treatment, we can do more passes if there's more laxity. So there are ways to adjust how many passes that we do in order to achieve the desired outcome. So as an ultrasound device, it's safe. We don't need to wear goggles. So I just have my glasses. My patient doesn't need eye protection. We're going to start treating her cheek. But before we do that, there are some no-fly zones that we can't go over. So we can't treat centrally here. We can't treat to the side because there are some nerves that we definitely don't want to disturb or heat up. And there are some nerves that are kind of like about a finger breadth at the corner of the mouth here that we also don't want to heat up and cause damage to those nerves because they can affect the smile. Out here is safe. This is only 1.5 millimeter deep, so you can actually go a little bit more medially than Ulthera. And you can treat this zone to kind of give that eyebrow lift. On the jowl area, you can treat anywhere on the neck except for the thyroid. Today, we're just going to be treating her face, but for a patient that's coming in for the neck treatment, we can pretty much treat everything from the side of the ears down. Your thyroid glands live here, and the ultrasound heat can go pretty deep. You don't want to heat that up, so normally we avoid that area. So that would, if we were to treat the face and neck, that would also be a no-fly zone here. Okay, so now that we've done our marking, like any ultrasound device, we need some gel. So I'm gonna have Lorraine turn to her side. Let's go to your left side. And we're gonna put the gel on her face. And typically the standard protocol is 2 passes, one horizontally and one vertically. But for someone with more laxity, the clinician has the discretion to go up to 4 passes to heat up the skin more. Okay. So on our device here, it's on standby, so I'm going to take it off standby, and we've kind of, the pulse duration is standard at 5 seconds. We're starting her at the middle of the road setting at 3.6 joules, and we're increasing the cooler time for comfort. So we're going to start going horizontally first. You ready, Lorraine? Mm-hmm. All right. So once it's on ready mode, I'm going to start treating her. So when we go horizontally, I'm going to go up like this, across all the way to here, and then we go back around and go vertically like this, and we do 2 passes. Lorraine doesn't have too much skin laxity, so I think the standard protocol with 2 passes will work perfectly for her. You ready?
Yes.
Okay. So now we're ready. We're gonna fire. What was your discomfort level?
Maybe a 3, not too bad.
Okay, so prior to the procedure, she did have numbing cream placed for approximately 1 hour. We also gave her some ibuprofen, just like Ulthera, for someone who has, a little bit discomfort with heat or this kind of like electrical heat sensation. You can also take Ativan or Vicodin prior to in order to minimize the discomfort. She also has a little stress ball that we give her to squeeze. And our other distraction methods for pain is to use like a vibration device. But in general, I would say it's uncomfortable but not tolerable. Would you say that, Lorraine?
Yes.
Okay. So we're doing another pulse here. Okay.
Yep.
Some areas, just because it's more sensitive than others, she may feel the discomfort a little bit more. And because bone conducts heat, what I experienced was it was a little bit more uncomfortable along the jawline and when we get up close to the cheekbone. Okay, are you still at a 3?
Yeah.
Or
Mm-hmm.
so it's pretty consistent throughout this whole roll?
Yes.
It's a very systematic protocol that we go through. Very hard to kind of deviate or fail. You just have to make sure you uniformly heat up the skin throughout. And by doing so, you're spreading that heat energy evenly throughout the treatment zone in order to stimulate collagen remodeling. And when we can generate new collagen and new elastin, the skin tightens up and you will see a minimization of skin laxity, fine lines, wrinkles, and then a little lift as a result of that as well. So very similar to Ulthera, the technology are both ultrasound, getting the skin heated to that higher temperature, getting to that deeper level. The difference, I would say, is because they've updated the handpiece to deliver 7 rows of energy all at once. You're doing fewer pulses, so the treatment goes a little faster than Ulthera. Having said that, this is a new device to us, so we're still trying to get some real world data and information on this. Hopefully all of our patients will get those excellent results like the brochure, but of course, like I tell patients, due to the fact that each one of us heal differently, even though we do the exact same parameters, deliver the heat the same way, we all stimulate and create collagen at different rates, so hence there are individual responses. The younger that you get started with this, you're going to see more impact from the treatment just because our wound healing capability diminishes over time. We recommend follow-up at 3 to 6 months to kind of monitor the results. And most people who are kind of like on a treatment plan to maintain their collagen and reduce skin laxity, I would recommend doing the treatment if you can afford it yearly. If not, you can go as far as every 2 to 3 years for this, because again, gravity and the process of collagen breakdown continues. How are you doing in that mid-zone? You
Good.
okay?
Mm-hmm.
All right, so we're getting close to where my X is, so we can do one more row, and then, or one more column, so I know we'll go ahead and switch to the vertical direction. So last Friday, Lorraine got to try this without any numbing. And then she did some numbing today. Do you think that the numbing helps a lot?
Absolutely. Makes a big difference.
She actually have tried Ulthera before too. So do you feel like you would need the help of any Ativan? You took some ibuprofen today. You did not do Ativan.
I did not
Do
do
you
Ativan.
feel like that would be beneficial?
No, not how I'm feeling now, but how I felt without the numbing, absolutely.
So the treatment time for this is approximately 1 hour if you're going to do the full face and neck. So yeah, we're very excited. I'm going to just keep on treating Lorraine. It's not a most exciting procedure to watch. I think you all have the idea of what's going on, but this just gives you an idea of what to expect with the procedure, and the pain and discomfort that you may experience. And like I said, we're excited to see as we treat more patients what kind of results they're going to get. Thank you.